Most people overtreat hypoglycemia, and most often they don't realize this. This includes my humble self. You feel all the shaking, the sweating, the panic, and before you know it, you have eaten half of your kitchen. Yes, you heard me right. Before you know it, you've eaten half of your kitchen. Next, your blood sugar shoots up and you're stuck on a roller coaster for the rest of the day. This is a reality for most of us who live with type 1 diabetes or manage their diabetes with insulin. Today, I'm just going to break down the correct evidence-based way to treat a low blood sugar and how to stop over treating hypo for good. What is hypoglycemia? This is simply when your blood glucose drops below 4 millimole per liter or 70 mg per dl. And this can happen due to too much insulin, delayed meals, exercise, even the hot weather, alcohol, or even stress. The next question would be, why do we actually overtreat hypos? Well, this happens because hypo kind of like triggers your body's survival alarm. So that's the survival alarm system in your body reacting, and if you're not cautious, you end up overtreating the hypoglycemia. So when a hypo happens, your brain starts to scream, eat now or you will get worse. So instead of 15 grams of the fast acting carbohydrate, you end up eating biscuits, juice, you grab a chocolate bar, then you add a sandwich and then another snack because your body is scared. The truth is, you only need a very small measured amount to actually fix a low blood sugar slowly. So the correct treatment is the 15-15 rule. I will give you a few examples that work best. So we're going to start off with step 1. You can use 4 glucose tablets. You can use 150 ml of pure juice. You can have 3 teaspoons of sugar dissolved in water, preferably half a glass of water, and you can have glucose gels, non-diet fizzy drinks, roughly about half a glass preferably. And then step 2, you have to sit and wait for 15 minutes. So this is where it gets quite tricky, exercising that self-control and not eating more. This is actually the hardest part, but it's the most important part. Now, step 3, you recheck your blood sugar levels. If it is still below 4 millimole per liter, just go ahead and repeat the 15 grams of any of the fast-acting carbs I mentioned previously. If above 4 millimole per liter, you move to step 4. So step 4 is eat a follow-up snack only if your meal time is like an hour away. Examples like 1 biscuit, a small apple, half a sandwich, half a banana, and you can have crackers with some peanut butter. So this actually prevents a second hypo without causing that giant spike that you would see when you're eating up the whole kitchen. So now let's move on what not to do. Over treatment mistakes. Number 1, you're grabbing your chocolate bars. You need to remember that the fat contained in the chocolate actually delays the absorption of carbohydrates in your bloodstream. So there's going to be a delay on your blood sugars coming up. And then you're eating everything in sight out of, your body is panicking. Number 3, you're drinking the whole carton of juice to treat a hypo. And you're also taking slow acting carbs like your bread before you take the fast acting carb. It should be the other way around. First, fast acting carbs before the slow acting carbs, and then using food instead of glucagon for severe hypos. All of the aforementioned don'ts result in what we call a rebound hypoglycemia. In all honesty, I sometimes find myself doing this, especially when I have a very busy clinic ahead of me. Truth must be told. So I'm not going to lie about that. Um, I also make mistakes in my hypo treatment. So what you need to have at the back of your mind is you have like small corrections, which equates to a smooth recovery, and then also have at the back of your mind that when you overcorrect, it equates to roller coaster glucose levels. So now let's talk about the smart tips to avoid that overtreatment of a hypo. So here are some strategies to help you stay calm and you take total control of your hypo treatment. Number one, you should always carry measured hypo treatments. Pre-portion your glucose tablets, and then you tell yourself, I only need 15 grams to survive at this moment. And then you time yourself to stop panic eating. Keep your chocolates for enjoyment, not for treating hypos. I repeat, keep those nice tasty chocolates for enjoyment and not for treating hypos. And then you need to understand that hunger during a hypo episode is actually hormonal and not actual starvation. I repeat, hunger during a hypo episode is hormonal and not actual starvation. And you also need to practice mindful breathing during those hypos. You can use your self blood glucose monitoring and your CGM trends to just look at how the before and the after hypo treatment trends are going. So don't just assume, oh, my hypo, my blood sugar levels should be like maybe 6 now. You need to monitor the trend from when you started treating the hypo and after you have treated the hypo. The goal here is to treat the hypo and not create that big giant high. Now, when to use glucagon. If you are unconscious, unable to swallow, you're probably vomiting, or you're still dropping dangerously low, even after you have had all these carbs, you've treated the hypo, you need to get help and use the glucagon. I've had this a couple of times. So this is actually very, very life-saving, and it prevents that forced feeding during severe hypo episodes. My final takeaway, hypoglycemia happens, but how you treat it can make all the difference. A controlled, measured response will actually stabilize your glucose, reduce stress, and give you more confidence in your diabetes management. Call to action. If this video helped you, I need you to hit the like button and share with someone who needs it. Subscribe for more practical diabetes education, and please, I'm looking forward to your comments below. Do you struggle with overtreating your hypos? Let's talk about it. So get right into the comment section and let's have a discussion about this. So I'll see you all in my next video. Bye.